We are at Dr. Karishma Aesthetics, and today I'm going to clarify all you need to know about gynecomastia. Well, what can happen if you do not treat your gynecomastia or your male boobs? Well, it doesn't really matter. It's not a condition that can cause you any harm. It is not a serious medical condition. The most common reason that we treat gynecomastia is mainly for aesthetic purposes, and if the chest is looking very protruding and men are conscious wearing their daily clothes, any tight-fitting clothes, and men are conscious about wearing tight-fitting t-shirts. Some men don't want to remove their t-shirts in public, say they're going for a holiday, they don't want to get into the swimming pool or on the beach just because they're very conscious about the look of the chest. So gynecomastia can be kept aside, but if you have aesthetic concerns about it and the condition is distressing you and you're anxious, that is when you can get it treated. If you let it be, it's just going to be the way you are. Sometimes the gland may become bigger as you age, but if you just want to leave it and you don't care about it, that's up to you. Exercise is a very important routine to keep these man boobs in control. Exercising, when I mean exercises, it is strength training, weight training, doing a lot of chest workouts, building your pectoral muscles. It is important, and to some extent you can lose the excess fatty tissue which is present underneath the chest. Well, but gynecomastia per se cannot be treated even with the exercise. You may become extremely fit and slim, but you will still notice that there is some lump which is there underneath the nipple and it is popping out. In that case, no form of exercises will work. I have operated on a lot of bodybuilders and trainers who have developed this gynecomastia because of steroid use. And because of their hormonal imbalances, they are absolutely fit, they have fantastic skin on the chest, they have good muscle bulk, but they still notice the little gland overgrowth underneath the nipple, giving a very funny and an awkward protrusion, creating a puffiness under the nipple, and no exercises will work. In that case, you have to undergo a small gland removal procedure. Gynecomastia is a daycare procedure, takes 45 minutes to about an hour. It can be done under local anesthesia and sedation, or sometimes under a short general anesthesia. You can go home the same day after the surgery. There are two ways of treating the gynecomastia. One could be a simple liposuction using a keyhole incision. The second is making a small 1 to 2 centimeter cut at the lower border of the areola and taking off the gland. In most circumstances, I usually choose liposuction as a mode to treat the gynecomastia, but if the gland is extremely large, then at times we need to make the tiny cut at the nipple and take off the gland. I always tend to combine a liposuction with this gland removal because there is always some surrounding fat at the side of the chest and sometimes underneath around the gland, which needs to be taken out so that you overall get a very good contour of the chest. There are times that you have a very high grade of gynecomastia. In grade 4 type gynecomastia, a man has almost like a female looking breast with excess skin and almost hanging chest. In that case, we also have to tighten the skin around the chest by removing a little bit of excess skin along with the gland removal.